Did you know that a simple sore throat, if left untreated, could one day damage your heart? It may sound surprising, but this can happen because of a condition called rheumatic heart disease. It develops after rheumatic fever, a complication that can follow an untreated strep throat infection. In today's video, we'll explain what rheumatic heart disease is, how it develops, its symptoms, treatments, and most importantly, how it can often be prevented. Welcome back to the channel. Now, let's learn about rheumatic heart disease and why treating a sore throat at the right time can protect your heart. What is rheumatic heart disease? Rheumatic heart disease is permanent damage to one or more heart valves caused by rheumatic fever. Rheumatic fever is an inflammatory disease that can develop after an untreated infection caused by group A Streptococcus bacteria, commonly known as strep throat. Normally, your immune system fights the bacteria, but in some people, the immune system mistakenly attacks healthy tissues, including the heart, joints, skin, and brain. When the heart is affected, inflammation can damage the heart valves. Over time, these valves may become scarred, narrowed, or leaky, making it harder for blood to flow properly through the heart. WHO is at risk? Although anyone can develop rheumatic heart disease, some people are at greater risk. Risk factors include untreated or poorly treated strep throat, repeated strep throat infections, living in areas with limited access to healthcare, overcrowded living conditions, children and teenagers between the ages of 5 and 15, a previous history of rheumatic fever. Prompt treatment of strep throat with antibiotics greatly reduces the risk of developing rheumatic fever and later heart damage. Symptoms early on, some people may not notice any symptoms. As heart valve damage becomes more severe, symptoms may include shortness of breath, chest pain or discomfort, fatigue, rapid or irregular heartbeat, swollen ankles or feet, dizziness, fainting, heart murmurs detected during a medical exam. People who recently had rheumatic fever may also experience fever, painful or swollen joints, skin rash, small painless lumps under the skin, uncontrolled body movements. In rare cases, if these symptoms appear, medical evaluation is important. Complications without treatment. Rheumatic heart disease can lead to serious complications. These include heart valve disease. The damaged valves may not open or close properly. Heart failure. The heart has to work much harder to pump blood through damaged valves. Atrial fibrillation. Damaged heart valves increase the risk of irregular heart rhythms. Stroke. Irregular heart rhythms can increase the risk of blood clots traveling to the brain. Infective endocarditis. Damaged valves are more vulnerable to infection. These complications highlight why early treatment and regular follow-up are so important. Diagnosis and treatment. Doctors diagnose rheumatic heart disease using physical examination, blood tests, electrocardiogram, ECG, echocardiogram, which uses sound waves to examine the heart valves, chest X-rays when needed. Treatment depends on the severity of the condition. Doctors may recommend antibiotics to prevent future strep infections, medicines to reduce inflammation if rheumatic fever is active, medications to manage heart failure or irregular heart rhythms, regular heart checkups, valve repair or valve replacement, surgery if the damage becomes severe. Following your doctor's treatment plan is essential to protect your heart. Prevention. The good news is that rheumatic heart disease is often preventable. Here are some ways to lower your risk. Treat sore throats caused by strep bacteria promptly. Finish the full course of antibiotics exactly as prescribed. Practice good hand hygiene to reduce the spread of infections. Visit a healthcare provider if a sore throat is severe, lasts more than a few days, or is accompanied by fever. Attend regular medical checkups if you've had rheumatic fever before. Taking these simple steps can help protect your heart for years to come. Rheumatic heart disease is a serious but often preventable condition caused by damage from rheumatic fever. Treating strep throat early, recognizing the warning signs, and getting regular medical care can greatly reduce the risk of long-term heart damage. Thanks for watching, and we'll see you in the next video. Stay healthy and take care of your heart.